I've done probably over 10,000 facials in the 24 years that I've been a facialist, and I've learned a lot of things. So stay tuned. We're going to talk about it. Welcome back. Christine Byer here, licensed master esthetician for 24 years. That's right. I got my license in 2001 down in Florida, and I've done a lot of facials. I have done a lot of facials. And what does somebody learn? Number one thing I think I have learned that we all carry so many emotions in our face. The emotions are intricately tied to the muscles of the face, and those repetitive facial expressions etch into our face over time. And that's why I emphasize massage so much. Now, not over massage, not crazy gua sha, like stone yourself to death, but targeted massage once over every 1 to 2 weeks, and then working on your trouble spots on the regular. We get these fascia fault lines, as they call them, and some of them run in very usual places like around the eyes and around the lips and laterally on the forehead. They etch a story into our face, and that's a beautiful story, but it also occludes proper blood flow and proper lymphatic drainage and all this kind of stuff. And so I go in and sort of strip all that out and get the blood flow in and get the lymph drain in. The first things I do to clients is release this sternocleidomastoid. Yeah, so we want to release this. It's one of the first things I do because it helps stack the head back up on the body and lets everything drain and helps us basically move around the world better, you know? So yeah, we can do these things. We can relax our neck. We can relax these tight facial muscles and relax our chest muscles, stretch them out, do a little yoga. And that's going to go a really long way in making us look as good as we can look as we age. So another thing I've learned after doing 10,000 facials, everybody has their thing that bothers them about their face. Pores, wrinkles. I had a client, this is when I first started doing facials. This was in Miami, and I had a client who had the most gorgeous skin, and she was Norwegian, and you could hardly see her pores. They were there, everybody has pores, but just immaculate skin. But I looked at her consultation form, and what was the number one thing that she said bothered her? Her pores. So it's kind of crazy, but we all have the thing that bothers us that most people don't even notice. But the good news is we can begin to sharpen up that jaw and change that face shape a little bit with proper facial massage. If we're clearing out the lymph, we're releasing our neck. Now, as we age, we all turn, from V-shaped to sort of square shaped, and that happens. But with proper massage techniques, you can make this area look better. 100%, 100%. Another thing I learned after doing 10,000 facials, and seems like a no-brainer, but everybody's needs are so different, right? There are some people that have just an overabundance of oil and moisture in their skin. And then there are my older clients who may still have some oil, but they're dry as a bone water-wise, right? I'm seeing better skin now, but still I would say I see still a lot of dehydrated skin. And that is such a simple fix. That's something as simple as adding in an ampule or an essence. So most people have vastly different needs for their skin, and I just have to go in and sleuth around and see what do we need. And then there's also the thing that there's so many skin influencers out there now that really don't know anybody else's face but their own. Experiment of one. And so I tend to follow other people who work on lots of faces, and those aren't always just estheticians, but estheticians tend to have the most hands-on time with their clients. And so good ones, I think, really understand, can actually look beneath the skin and see what's going on. I mean, we know skin, right? Another thing I've learned after doing 10,000 facials is most clients have so much neck tension, neck and shoulder tension, that it affects their face negatively. This is why I teach releasing all of this so much, because tech neck is such an epidemic. I see it on everybody. Everybody's hunched forward and they all have overly tight CMs, and all this is just a mess. And so they're holding on to a bunch of lymph here because this is overly tight and can't drain. And if you have that, see some of my older videos on how to release tech neck, because it will make your face and your under the chin area look svelte. You can hold a ton of tension through the lips. So doing an inside the mouth buccal massage will help erase a whole litany of lower face issues. It can even change the way the face will lay, especially under the eyes. And so to separate this out, If I'm gonna be working on lip lines, I will go in and I will release the jaw on the outside, and then on the inside, you're gonna wanna release those, release the jaw, release this area, and then you will see this lay flatter than it's ever laid before. Lip lines, it's just a tough thing to get rid of. You can do Botox, it is off label, and you might not be able to use a straw afterwards. So be careful with that. But yeah, this is a kind of a thing we have to just do upkeep, upkeep, upkeep. Always release the jaw, because if the jaw is overly tight, we will get pain face, where everything is kind of smashed in and down, and we will purse our lips more. And I'm a purser, so I speak from firsthand experience. Bags under the eyes, they can be caused by a whole bunch of different things. If you have those malar bags where you can see like a big split in the skin, like there's a big sort of a wrinkle right here or a line that demarcates where the fat pad ends, and you want to do this gently. You're stripping out the buccal muscle and you're sort of releasing all of this underneath. And then I will go here and I make sure that this is nice and wet or has some slip and glide or grapeseed oil, some sort of oil on the outside, so that when I'm sort of pulling and massaging out all that stuff from the inside, this lays gorgeously. And this is something you notice after a few weeks of doing it. I've had clients notice it before because they're just, especially if you get a lot of sinus buildup and this sort of stuff, this area from here to here is just a brick on people with malar bags and lots of sinuses. And so when I go in and sort of strip that out from the inside the mouth, it starts to lay better because all of this starts to drain better. And this is where our sinuses are, right? And so all of this starts to drain better and the face lays better. Those are the things I have learned after doing 10,000 facials. Thanks for watching. Bye now.